So today we are going to be discussing an issue that actually caused fight between me and this woman when we started this job. You understand? We almost fought, but thank God we did not fight. We actually looked at it and we were able to find solution to the problem. And the topic is what do you think? Oh, probably you have seen the topic, right?
Yeah.
Okay, it is doing the do. Doing the do during pregnancy. So I had issue with my wife when we started. You understand what I mean? I had issues as in, but we did not fight anyway. We had to look at it and we were able to find solution.
Yeah.
Doing the do, as you know, is very important. And yes, okay, let me say this. The essence of this video is to settle some scores among marriage couples.
Yeah.
You know, some of these things happen and we don't know how to go about it. So we are actually giving you the solution today. You understand? So doing this do is important, like we know. You understand? As married couple. So when we first got married, my wife will not do the do. We don't want to allow do the do.
During pregnancy, please be specific now.
Yes, during pregnancy. During pregnancy.
Doing
You
the
understand?
do during pregnancy, that's what we are talking about here.
You understand?
Yes.
So it was like, why would I do the do? And she's like, I'm pregnant.
Yeah, so a lot of us have reservation during pregnancy about doing the do. Because number one, we are not certain if the baby is safe, you know. That was just the fear. You know, that's why I didn't want, hey, as if I've not already carried enough load on my tummy. Somebody is not saying he wants to see. You understand now, women, you know the matter inside. They will never understand because they have never carried pregnancy.
We have never carried, but
have you carried?
we've not carried, but we are
carrying from behind.
You understand?
Moral support. So I was scared because it was my first time getting pregnant. You know, they will always say, be a good wife, be submissive to your husband, but nobody really tells you that there are other underlying things that one needs to learn and one needs to do. And
Like
most of these things you learn them with your own experience. So I was pregnant and somebody saying lie down. So it's not like I didn't want to do the do, but I was just worried for the baby.
She wanted to do the do.
I was scared because I really don't know whether I was going to affect the baby, the fetus. I wasn't sure. So I was really, really, really skeptical. So that's what happened.
Oh, that's why he didn't want to do the do. So what do you guys think? Did you do? What do you think during marriage? During pregnancy. Why? No, this video is for married couple.
Yes, please.
It's not for five-a-side. You know what I mean? You understand what I mean? It's not for, you understand. So we are talking to a married couple now. So if you are not a married person and you're watching this video, please stop watching now.
No.
Oh, or if you are intending to get married.
You see, we are trying to teach a process.
Okay.
Because eventually they will get married. But if you say this video is not for kids, yes.
It's not for kids.
Yes, but then every single lady is going to eventually get married.
And every single man will
yes, they also get married.
Okay.
And then they will have to, at one point in their life, pass through this phase.
Oh, okay.
So it's not just, it's not for kids, but it's a learning, sharing section where you can learn, even though you are going to use this experience in the future. So yes.
While you're married.
Yes, they can actually watch it.
Okay. So what are we talking about? Doing the do. Is it important?
During pregnancy.
During pregnancy. Can we do the do during pregnancy? And our answer is
yes. You can. Yes.
You can actually do the do during pregnancy.
Yes, we can actually do the do during pregnancy because Oga would not let us rest because it was, his blood was so high.
Yes, my blood was high. So please keep watching this video because in this short tutorial or life lesson, we are going to be talking about importance of doing the do. As in doing the do.
Is it safe? Number one.
It's safe.
Is it safe?
Number two, we are going to be talking about why you should not do the do.
And the positions that you need to be in when doing the do.
Then
and the third point, the
is
benefits of doing the do.
So you need to be.
You have to watch to the end of the video so that you're able to get all these facts.
So you get all those facts. So now let's get into it.
Yeah.
Is doing the do safe, Sweya?
Yes, it is safe. It is absolutely safe because your baby is protected already in the womb.
Okay.
God knows the way He does His things, so it doesn't really affect. Although doctors have advised that you shouldn't do the do in the final phase of pregnancy, the final trimester, like the final week actually.
The final week, like maybe like 1 week or.
Yeah. So the thing is that your EDD is plus or minus 2 weeks, so it's better when the last 2 weeks, so that your baby you don't be doing the do and your baby is planning to come. By that time the baby is already in shape, ready to pop out.
Okay.
So it's really not safe according to the doctor. So to avoid complications, the last 2 weeks it's not safe to do the do.
Okay.
Yes,
the last two.
yes,
So
the last 2 weeks
that means we didn't do the do in the last 2 weeks. Oh, I'm
yes,
trying to flashback.
we did not do the do
okay.
in the
She
last
said we
1
didn't do
month
the last.
because I didn't even know that it
The
was
last
2
1
weeks.
month.
Yes.
Okay. All right.
Because I wasn't sure. It was after we said that we were setting that 2 weeks before, but it also depends. It also depends, and then the baby is absolutely safe. So you
Very
can actually
safe.
do the do. But then in the last 2 weeks, please refrain.
Don't do the do.
Don't do the do.
Okay.
So let me tell you something here. In the second trimester, most women get this sexual desire, like it increases, like their desire increases. So I want to plead with our daddies, our husbands, please, when your wife starts telling you that she needs that relief, and please do not deny her, no matter how tired you are, because for some women it actually increases, that urge actually increases during the second trimester. So you need to help them, but then now you have to also consider the position, because in the second trimester the baby is already going to 4 months, 5 months, 6 months,
so
right?
Position
so
matters.
the position now matters critically during this period. Yeah, so that is, please, when mommy is doing dear, please, come close now, come close.
I don't want to come close.
when mommy starts, so I need to be clear, it's not for every woman, but most women during the second trimester, they tend to get this urge as
the urge
cravings. Yes, it's really, really high. Please don't deny them, help them out. It's the baby, it's because of the baby. It's the baby's fault, so you need to help them. But then you have to consider missionary style is a no.
Oh, don't do mission.
It's a no. The missionary style.
Not going to church. No missionary style. Okay.
What do you mean by not going to church?
Oh, missionary. Don't become a missionary.
No, at that period it's not really safe. It's safer that the lady is lying on top of you, not really lying, like she can be in a sitting position, or she can lie by her side. Those are the safe.
Are you learning?
Yes, those are the safe. Those are the safe ways that you can meet her.
No missionary.
No missionary.
And
no back lying. Don't come on top of her.
So a missionary is lying on the back.
I'm kind of explaining it. Yes. So lying on the back, please, you say no, don't come and press our baby, please, all in the name of pleasure. So it's a no.
But she can be on you at the
side. Yes, she can be on you. Like she can sit, she can
sit on you.
Like sit on you, and also be careful about the baby, so you don't kind of compress the baby somehow. The baby is safe, but just to be on the safer side, and then the side.
So side is better. That's what you're saying.
Side is also is good.
Side is better.
It's a better and a more convenient.
Okay, maybe we should say side is better.
Yes, it's
do
more,
the side.
It's more.
If you're afraid.
You said that do the side. It's convenient. I mean, she can just lie by her side, and then we continue what we need to do.
All right, thank you.
In the other room.
In the other room. All right.
Okay. So talking about positioning, there's another thing I need to make clear.
Okay.
So some people like doing oral sex. It's a no during pregnancy, irrespective of the trimester, because it's threatening. It's threatening for the future.
It's life threatening.
Yes, both for you. It's not safe actually. It's really not safe. So please don't do oral.
No oral.
No orals during pregnancy. Please just meet her the normal way you're supposed to meet, and do what you need to do, and then you meet. And also, in case there's dryness, please use lubricant so you don't injure the walls of our uterus.
Okay.
Yes, use lubricant. pregnancy. And then
Advice.
I need to also bring to your notice, very, very important. Please, if you have an history of miscarriage,
Okay.
please don't have sex. Please.
Okay. Are you hearing
Yes,
that, lady?
history of miscarriage. Don't.
Or
please.
couples,
Yes.
when there's history of miscarriage,
Yes,
okay,
please.
no sex.
Please, you just have to bear, no matter the urge or the cravings that you
Okay.
have, please. Yes, because you already know that you have a history of this stuff, so it's better we just avoid anything that will trigger, anything. So once you have an history like that, please, you have to be very, very careful and abstain from
Don't
it.
do the do.
Yes, abstain from it.
All right. Which other point do you have?
History of miscarriage, please, because it might lead to premature birth.
Premature birth.
Yes,
Okay.
the baby might be premature, and if as at that time it occurs, the baby is not far gone, like it's not up to 6-7 months, the risk of saving that child would be very, very slim.
Okay.
So history of miscarriage, please don't have sex, because it might lead to premature labor, and we don't want to have that. We need our baby. I mean, after struggling and carrying pregnancy for how many months, then you now lose the child. That's not what we want.
Okay.
Again, if you have a vaginal discharge and bleeding, please don't do the
Why will a man want to even do the do when the woman is discharging?
No. What I'm saying, like, it's not like the man want to do the do when she's discharging, but because it's not like the bleeding just continues. It might stop, but so far you know that you are bleeding, you're having vaginal bleeding.
History. Let's say history
yes,
of vaginal discharge.
Yes, and bleeding. Don't do it. Don't do the do, please. We're just talking about the time that you shouldn't do it. History of miscarriage, history of premature labor, history of bleeding.
Okay.
Please avoid it. It's not easy. It's not going to be easy, but you just have to avoid it.
So that means your spouse has to be in the know.
Yes, of course. Yes. So even when you are
communication.
Yes, even when you are pregnant, when you go for antenatal, they will ask you all these questions. You have a history of this. Because it needs to be in your record, so that they can now carefully monitor the fetus
and advise
you on what to do.
Okay.
So when you have all these histories, please, and then when you are going to have multiple children or twins, please avoid it.
Avoid doing the do.
Yes, avoid doing the do. I'm sorry, guys, but you just have to avoid it.
Well, that person must have actually gone to the doctor. They've done scan, right?
Yes, of course.
And they now know the baby in a twin.
Yes, when you are going to have multiple children, you will know that your tummy will not be as for one child. Two it's always bigger. You get tired.
So what time did you? I cannot remember the time you actually went to do scan. Is that after 4 months?
Yes. All these things are during the second trimester. That's when it starts.
So that means the man will not do for. No, we need to let him know.
Yes.
You need to let the guy know now.
That for
he will not do it if your wife is going to give birth to twins or triplets or quadruplets.
From the second trimester,
you are
have
not
to
doing
stop,
it.
please. You don't need to do any other thing. Please just follow yourself. Just bear with us.
Bear with us.
So when she has given birth,
you lock up.
You can do like 1 million do. Depending.
No, you are saying when she give birth, there is also time in that. So when she give birth.
6 weeks now. That one is better than.
Was it 6 weeks we allowed me to do?
Oh,
because 6 weeks is how many?
But the first baby we didn't know, so it took a while before we did. But when I had the second and third, they already started orienting us that after 6 weeks, provided the lady is healed, she has healed.
Because there's always suctioning and all of that.
Not always, but there is always stay and wear, and the thing coming back together again. So provided she has healed, but 6 weeks is the time. In 6 weeks, a woman's this thing ought to have healed.
What is this thing?
I don't want to say it.
Okay.
You know now where she's giving birth from. What's your problem now?
Oh, alright. This thing for ladies it should have
your kidney would have started to heal.
Okay. Or would have healed.
Some women 6
weeks. 6
weeks is the actual time, but then if you have suction and depending on how you give birth.
What do you call that suction? There's a name. I cannot remember. There's one name you guys used to call that thing.
Are you a doctor?
Oh no, I'm
Let
not.
the doctors tell them.
Okay.
It's episiotomia. Please, I cannot remember the name. It's something like that. Anyways.
You should know. You'll be woman now.
Yes.
Sorry, I don't know it, so let me not say.
But you are getting it, that's the word for it actually.
Alright. So what next?
Okay, so now we're going to talk about the benefits.
The benefits All right, the benefits.
Oh no. Yeah, before.
Okay,
we go
before
to
the benefits.
Oh.
Yes, before we go to the benefit, when there are some things you see
Yes.
that you need to tell your doctor. When you see some of these things, you need to let the doctor know. So tell us the things.
Doctor, this when you start experiencing or feeling vaginal discharge, bleeding, vaginal bleeding actually, because I mean discharge is common, but that bleeding,
When there's
say no,
bleeding?
yes, when there's bleeding, please see your doctor immediately. When you're having abdominal pains,
Okay.
when you are not feeling pain, you're not supposed to be feeling pain, but when the
During
pain,
pregnancy.
yes, when the pain now it's not persisting, please
See your
hurry
doctor.
up and see your doctor, right?
Okay.
See your doctor. And then when significant pain, okay, I've said significant pain, and then please, apart from seeing your doctor, if you don't want to do not hesitate to tell your partner.
Okay.
Communication is key here in marriage. Everything that we do, communication is key, because don't assume that he knows. Don't
This has
assume.
helped us. We've been communicating. It has helped us.
Yes.
We are actually telling you some of those things we did.
Yes.
This is 10 years, right?
Yes. 10
This is
years.
our 10 years in marriage.
Yes.
All of this that we are telling you, sharing with you, is what has helped us.
Yes.
Communication
Is
is
key.
key.
If you don't want it, please don't assume that he knows I'm pregnant. Don't assume when it comes to doing the do. There's no assumption.
Okay.
They don't really think. I'm sorry to say, because at that point in time, they just want to do the do. That's what I mean now.
Oh, okay.
It's not like you don't think, you reason,
Oh.
but when it comes to that time, you just, all you just want is to satisfy yourself. So don't assume that they know that you're pregnant, or they know that you're feeling discomfort, or they know that you're having pain. And again, please don't hesitate to call your doctor if there's a water discharge. Please don't hesitate to call your doctor, and please communicate with your husband. I don't want to do it. I'm not comfortable. I'm not convenient. Please let him know.
No. Okay.
Let him know. Thank you very much. Now to the benefits.
There are benefits. Nothing way they get benefits.
So in everything there's an advantage and disadvantage.
So
So we are here now to tell you the advantages and the benefits.
So before she starts talking about the benefits, please, if you have not subscribed, please now go and do the subscribe.
Help us subscribe. Show us love by subscribing to our channel.
So to the benefits. Here are the benefits.
One of the benefits is that it keeps you fit. You have just done some exercise.
Some cardio, right.
Yes, I've just done some exercise, so it keeps you fit. It keeps your
So
body
couples
strong.
are fit. This is an exercise that God gave us.
Yes, so
so it keeps you fit.
yes,
So
it keeps you fit.
and another benefit is bonding. Bond, like
yes, there's bond between partners.
Bond between partners. We've talked about this before in one of our videos.
Yes.
So it creates that bond.
You look eyeball to eyeball when you are doing this.
The bond is there.
Yeah, you share intimacy. You cuddle yourself. You say sweet words. So that improves the bonding.
So it also improves the immune system.
Yes, it does.
Sex does that. If you don't know,
yes.
find out. It improves your immune.
Yes,
so,
and it also gives you that orgasm, helps you to reach that orgasm that eventually makes you very, very happy. Yes, it makes you happy. Yes, it makes you happy for your life. It makes you happy for your husband. It makes you happy.
You are happy generally.
Yes, you're just happy general. Yes, you're happy. It makes you really, really happy. Happy there.
Yeah. I know when
So those are some of the benefits
yes.
of doing the do. Yes, those are some of the benefits. So
good. So I hope you guys have learned one or two things today. Today we have actually brought you the reason why doing the do. You understand what we mean?
yes.
All of this time.
Why it's important.
Why it's important when your wife is you understand is pregnant.
And the period that you shouldn't do it. And the positions.
Those positionings.
Yes.
The importance, the benefit, why you shouldn't do it, and all of that. So I'm sure you have learned something. Share it. Let somebody else see this video too. Let somebody learn.
Yes.
Because on this channel we are just here to teach, to educate ourselves, to share one of the things we've gone through, one of the things we've done, our experiences in marriage. Okay, that's what we're doing. So share it. Let somebody learn.
Yeah.
And what we want to say, thank you for sharing. No, before that, thanks for sharing in advance.
Yes.
And also, Thank you for watching this video.
Please do not hesitate to subscribe,
like,
yes, and
share,
and comment
and
below.
comment.
We want to hear your comments.
Let's
we want
hear
to
your thoughts.
Yes, if you have your own experience and the things that you feel like should be done or the position, please go to the comment section below and comment.
Tell us what you think.
Yes.
On a general note, on all of this that we've said.
Yes.
You might have one or two things to add.
Yeah.
Let's see.
Yeah.
Thank you so much. And
bye.